Morning to you. How are you on this Friday?
Good morning, Asanda. Thank you so much for having me, and good morning to the listeners too.
We appreciate you making time for us again this Friday. Let's talk about MSF and what you've seen then on the ground as MSF that prompted this warning about access to healthcare in South Africa.
Yes, Asanda, thanks for that question. And as you've already alluded to in your intro, our assessment was prompted by the reports which you have been following about the denial of access to healthcare to non-South Africans. So an MSF team visited 15 hospitals and clinics in Gauteng. What we basically wanted to understand was the severity of these blockages and basically the needs of people who are impacted by the blockages. And we really did find disturbing that the situation is disturbing Asanda on the ground. I mean, we are talking about pregnant women, patients who are on ARVs, and people who are on chronic medication who have been struggling for the past several weeks to get any form of medical services. Some just basically need their files so that they can be able to go to other health facilities that are not blocking patients but cannot because they cannot even be allowed to get their files. Some just need prescriptions to be able to get refills. Think of people who are on ARVs and other medication which you cannot get at the pharmacy if you do not have a script. So we are basically speaking out as Doctors Without Borders to ensure that this problem, which is still going on, gets the attention that it deserves from the relevant authorities, especially the Department of Health.
How are these groups blocking people and who exactly are they targeting?
Yes, so it's a very strategic. If you remember in the beginning when the story broke out, we would see, I mean, on social media, large groups of people blocking and protesting outside clinics. When the MSF team went this time around to the facilities that we visited, we realized that it's a strategic mode of doing things right now, where you find about 2 or 10 people stationed at the clinic's gate or inside and basically blocking whoever is coming through, whether you're South African or not. But the target is non-South Africans because they're being asked to produce their identity documentation and to determine if they are legally documented in the country. So basically, if you are not South African, you are then denied entry by virtue of you not being South African.
Is this happening only in certain provinces in terms of what you've gathered with your research or across the country?
We would say across the country, but our assessment focused mostly on facilities in Johannesburg, Durban, and Tshwane, because some of the patients that we were in touch with were through calls. Some we visited in and around Johannesburg, and some we contacted them through calls. Some were based in Durban and even in Pretoria, where they were telling us altogether we were in contact with about 50 patients who told us that they have been denied access to healthcare in 24 health facilities across Durban, Johannesburg, and Pretoria. That's where our assessment as MSF basically focused on. And we did manage to confirm that even though not all the 15 facilities that we visited were blocking people, but more than half of them were blocking people from accessing healthcare, which we find absolutely unacceptable given that the South African Constitution guarantees the right to free access to healthcare for everyone who lives in the country. Everyone is used deliberately in the Constitution because the human rights in the country are not only limited to South Africans. So we are speaking out to ensure that people are aware that everyone deserves the right to health care, and to also raise the alarm of the brewing challenge, especially to the public health system itself, which will later face a bigger problem if this current crisis is not given the attention that it deserves.
Yesterday, we carried an interview or a conversation with a group called Operation Dudula, who have openly admitted that they do have an issue with foreign nationals, those who are undocumented specifically, having access to healthcare services because it further strains our health resources. In terms of the undocumentation of foreign nationals, what have you seen? And those who get turned away from accessing healthcare, is that a big enough number that we can say it's only undocumented foreign nationals, as the Operation Dudula, that movement that's now become a political party as well, are saying that they're targeting? In your views as
Mm,
MSF, what have you seen?
yes, Asanda, as MSF, our actions are guided by medical ethics and our principles of independence, impartiality, and neutrality, which enables us to provide medical care to everyone, regardless of their documentation. So we care about everyone. We were not basically focused on whether or not people are documented, because for us, that is not a big issue. We are not saying this is not an issue. We are saying that as MSF, we want to enforce respect for everyone who deserves the right to free access to basic health care. So what we found was that people were being turned away. Yes, they were being asked, do you have do you have documentation? And what's disturbing, Asanda, some of the members who were in civilian clothing, we wouldn't say they were from Operation Dudula, but they did say we're supporting the actions of Operation Dudula, but most were community members or in civilian clothing. They said to us, we do not want non-South Africans to access healthcare, because we believe that it's only South Africans who should be assisted. It's only South Africans who are paying. So we did not get a sense that it's actually about documentation, but the fact that if you are not South African, you are not entitled to access healthcare in this country.
Jane, I don't know if you can hear me, but the line is breaking there a bit. It sounds like it's a network issue. Can you
Hello,
hear us?
Asanda?
Yes, I can hear you clearly now. Are you still there, Jane?
I can hear you now.
Just finally, the steps that MSF wants health officials to take right now, and I guess it will be a collaborative effort with other departments then in terms of governance, things like border control as well as home affairs.
Yes, definitely, Asanda. It will be a collaborative effort. As MSF, our role is to speak out. We want to raise the alarm to the issue, but we do believe that the government, especially the Department of Health, because they have a jurisdiction over public health care facilities, it is for them now to take the necessary steps to ensure that all public health care facilities are ensuring that people who deserve to be assisted for any type of conditions do get the attention that they deserve, regardless of their legal status in the country. In terms of migration issues, like you said, that it should be a collaborative effort. We hope that the Department of Home Affairs will come on board, and that everyone who needs to address the situation so that the country has a long-lasting solution, instead of apportioning blame to non-South Africans. And at the same time, as MSF, we are definitely not ignoring the cries of South Africans. We do believe that both opposing points need to be given the attention.
Right. Jane, your line has
But
gone back
we
to being scrambled again, so let's just leave it there. But I think we
hope.
get the gist of your final points. And thank you again for your time chatting to us here on Rise and Shine. Jane Rabothata is Communications Specialist at Doctors Without Borders, Southern Africa, and that's MSF, Southern Africa, raising the alarm on this very important issue. As she puts it, a solution is what needs to be figured out at this stage, instead of a blaming game and pointing fingers at different stakeholders or players involved on this issue. So at least we got the majority of that conversation before the lines jeopardize our conversation, and we leave it there for now. But 7:31 is the time, Central African time, and we get our news headlines now with Nolutando Butelesi.